All right, should we begin? It's 7 o'clock.
Mhm.
Yes.
Right.
Yes.
Okay, I'm going to look forward to the day I do not have to read this paragraph, but here goes. In accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting this evening, May 18th, 2021, on the Zoom platform in accordance with the town's policy directives and guidelines issued on April 1, 2020 as amended. I ask that all Board of Health members, town staff, and presenters and guests activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call and we'll start with an attendance. When I say your name, please reply. Jill Block.
Present.
Mark Haddad.
Present.
Alma Healy.
Present.
Ray Considine.
Present.
And Susan Rask.
Present.
All right, I am here as well. So agenda item 2 is a public hearing for the Concord Recreation Campsite assignment at Willard School. Susan, do you want to introduce the item?
Yeah, we have several representatives from the Recreation Department with us, and I'll let them speak to it.
Great.
They had requested they wanted to run a soccer camp program at the school this summer, which necessitated a campsite assignment. The soccer camp has since withdrawn, but since it was already on the agenda, I figured we would just proceed and approve the site, because once it's approved for good. And we've already advertised the hearing, and why not just go ahead with that? So Anna McCown, who's the director of the Recreation Department, is with us if she wants to explain things. And I don't know if you want to, probably don't, we put the site picture in the Board of Health packet, Anna.
Yeah.
So you probably don't need to. I mean, what we're looking for at the site is safe traffic flow for pickup and drop off, you know, water, potable water, sewage, shelter for the kids in the event of a storm. And clearly an elementary school provides all of those things. So I don't have any concerns with approval of the site.
Great. Well, thank you for the introduction, Susan. Like she said, my name's Anna McEwen. I'm the Director of Recreation, joined by Marty Hutchinson, a Recreation Supervisor, and Emily Madison, another Recreation Supervisor in charge of camps. So like Susan mentioned, we were hoping to run a soccer program at Willard this summer. That subsequently is no longer happening, but we do see future opportunity to run specialty camps, we call them, at some of the school sites. And we've had a strong relationship this year with the schools and using their spaces. So we think this would be a great opportunity to get this approved and have it as an option for a safe campsite next summer. The Willard School, we're currently running after school programs there, so we know the space very well. Emily is the site supervisor at that school right now. So we have a really strong relationship with the front desk team as well as the principal, and are very confident in the ability to put together plans for safe drop off and pickup, as well as assuring that the students and campers continually have access to restrooms, bathrooms, water and shelter, things of those nature.
Sounds good. Board members, any comments or questions?
No.
Well, I'm really glad that we're going to have camps this summer. It'll be really good for the kids. Do I have a motion to approve the Concord Recreation Campsite assignment at the Willard School?
Move to approve.
Do I have a second?
Second.
I second that.
Okay. We'll need to vote in roll call. Jill Block, how do you vote?
Approve.
Great. Mark Haddad,
Approve.
Alma Healy,
Approve.
Ray Considine,
Approve.
and I approve as well. So the motion passes.
Thank you. That was painless.
Yeah.
Appreciate it.
Much
Thanks
easier
very
than
much.
COVID stuff.
Yeah, this was nothing. Thank you.
All right.
All right.
Have a good night.
Thanks. Bye.
Bye.
All right, agenda item 3. Where do you want to start, Susan?
Well, we had put all kinds of things in your packet that we sent last week that are now obsolete. So I was going to add, the governor had revised his mask order to what I thought was very clear. So I was going to suggest that you rescind your mask order since there seemed to be some confusion between the two. But then, of course, yesterday, the Governor Baker announced that as of May 29th, the face covering order will be rescinded and all industries will be allowed to reopen with no capacity limits. So basically, what we thought was going to happen August 1st is happening May 29th.
Yeah.
Which is great.
So you will still have to wear face coverings on public transit. But other than that, no more face coverings. Bars and restaurants will be open at full capacity indoors. And he's going to rescind the state of emergency on June 15th.
And so all the, that update from the Office of Energy and Environmental Affairs, like that's all moot as well?
That's all moot now. Yep.
All right. Like the charter and boats and stuff?
Yep.
Okay.
Seemed good when they released it on May 10th, but now it's May 18th.
Okay, so, so we have to, do we have to formally rescind our mask mandates and guidelines or anything, or does the state's guidelines just?
I
make
think
our-
yours refers to it's in effect until the governor rescinds the state of emergency, but just to be clear, I would rescind it if that's what you want to do.
Okay. Okay,
It also-
think we should.
I'm sorry, Mark, what?
I was gonna say, I think we should rescind it because we tied it to the state of emergency, but I think that's like June 15th.
Yeah,
Right.
So I don't think we should have confusion about, that similar to the reason we would have done it anyway, which is that what's in effect right now is still less than it was before. I think it's just clearer. If we rescind it, then it's the state rule that people comply with, and then there's no confusion on that.
Right.
So would you rescind it effective the 29th of May in terms of what the governor is suggesting?
No, I would rescind it now because I think ours was stricter, and then it wasn't as strict because the governor got more strict, but then he got even less strict. And I just think it's too confusing to try to tweak it for a few, a couple weeks or whatever. I would just rescind it. So for example, now that we have outdoor school and outdoor sports that don't have the 6-foot limit, our order is like inconsistent with that. So
yeah,
it's clearer if we just get rid of it.
And the governor's face covering order, which is pretty clear, is in effect till May 29th. So yeah, I think it'll be clearer if you just rescind it.
okay.
Mhm.
Anyone have any other thoughts?
So just to be clear, what we would be rescinding is the use of face masks while you're outside is.
You'd be,
So what we would be rescinding is Concord's separate policy about the use of face masks. And I think I would want the vote to be clear that we're rescinding it because the state has updated its guidance. And so we're rescinding the separate Concord guidance so that everyone in Concord still needs to follow, the state's rules on that.
Oh, okay, all right.
Yeah, I mean, I think that's what I would do as well.
So withdraw the local Board of Health face covering mandate.
Right.
To be in
to be in
alignment with state.
In alignment with the state mandates
Mhm.
that are in effect until 5/29, or should I just say in effect with state mandate?
Just to in effect with state mandate, right? I mean, he could change his mind, he could do.
Which you probably will, okay. We need a vote for that one.
Well, if that's a motion, I would second that motion.
Okay. All right. Should we take a vote? Any further discussion before we vote? Okay. Jill Block.
I vote to approve the rescindance of the Concord mask mandate.
Okay. And Mark, how do you vote?
Approve?
Alma,
I approve.
Ray,
I approve the motion.
and I approve as well. The vote passes.
I think that will simplify things for the public.
I think so too.
Yeah.
Yeah. Is there anything else we need to rescind or fix?
No, the town manager, this has all happened a little bit quickly since Governor Baker just announced all of the May 29th things yesterday, and we don't even have any written guidance other than the press release. But the town manager asked, or he thought it would be helpful if you would make a formal determination as a board that you either think the governor's plan for May 29th is sufficiently protective, or whether there should be other mandates in Concord to improve the safety of the public. I think that's a really difficult question to make a decision on quickly. I mean, businesses, of course, can be more strict within the business than the governor's order will be. They could mandate masks be worn in businesses, or they could voluntarily reduce their own capacity, or whatever they want to do. I think it would be hard for you as a board to write mandates for various industries and businesses without a lot more thought than we could give it at this meeting. So I'm not saying you shouldn't. Well, you tell me what you think we should convey to the town manager.
I mean, I personally am very encouraged by the numbers. So I think the governor's right to try and open things up. It would take some really compelling data for me to want to write some mandates that didn't exist in Acton or Maynard or, in another town 10 miles away, So I think consistency is the best thing. So I would go along with state guidelines, but I defer, I would like to hear other people's opinions.
No, I agree with that completely. And I, for the reasons that you described. So, I mean, we can always revisit this if things are weird or go off the rails, or there's something Concord specific, but I mean, there's nothing to me specific to Concord that would make us feel like we need to treat Concord different than the rest of the state.
Yeah.
Right. And it also seems like the data shows that Concord's been ahead of the curve, ahead of the state rates in terms of vaccination. So if those lower rates are good enough for the state and ours are higher, it would just seem really just a little bit controlling,
Yeah, I agree. I don't
I
think we need to be big brother here.
I think Susan, something you sent out, it looked to me like there was a 70% vaccination rate in Concord. Is that correct?
I did send you the vaccine data. Yeah, I mean, we're in good shape.
So to Jill's point and to Mark's point, I think we really don't have any compelling reason not to follow what the governor has laid out.
Yes.
Yeah. And also that data Susan sent around, which was great, is a week out of date.
Yeah.
You might think that doesn't matter, but that actually is all the middle schoolers got vaccinated since in that past week, their first shot, basically, right?
Right.
So,
Right. And you see the numbers incrementally going up each week of that data. And it also seems like the requirements for mask wearing, continue in the places where there's risk, like the congregate care facilities, public transportation, et cetera. So if any risk remain, I mean, that's where people might be more vulnerable. So it just, there's precautions in place.
Right.
So I think my message to the to Stephen Crane would be that, we're comfortable with the numbers and the data and would, want Concord's guidelines to be the same as the state. Does he just want a sort of message or a decision or?
Yeah, I think, a lot of people from a lot of viewpoints are going to want the town to do this or that, but I think he'd like to know that he has the board's backing to just say, we're going to do what the governor says.
Right.
Yeah. I think, I think there'll definitely be people or businesses that, take a more cautious approach, and I totally support that. And there's people that will still be wearing masks because they are fearful or have risk factors. And, I think we can support that as well.
Can I ask whether or not this is going to be also a recommendation about numbers of people in gatherings?
As of May 29th, all those capacity limits are lifted, Jane.
That's what I thought, but we haven't done that officially in Concord. So for instance, the Memorial Day ceremony is limited to just veterans. And so it has specific, Concord townwide activities associated with it.
But we would follow the state guidelines until the 29th. So the Memorial Day festivities are, what are they, 30th, 31st?
Right.
Then other people can come. Right? That's what the state is saying.
I know, I'm just saying, I don't think that the ceremonies, the public ceremonies committee is quite ready to, like, it has some lead time associated with it too. But for, I'm assuming other events going forward would be different.
I
Yeah,
was wondering about town.
I don't think you need the Board of Health's, stamp to keep it to the group that you already had organized it to be and everything else, if that's what that committee wants to do, Jane.
No, I'm not, it's not my committee. And I don't mean it in that way. Maybe I'm being confusing. I'm saying that as of last night's meeting, the decision was to keep the Memorial Day festivities to just veterans. And if the recommendations of the Board of Health are different coming out of this meeting, it will, it will have an impact. I don't know how quickly Concord will, how fast that will take place in terms of public Concord events.
So I think that if a committee only wants veterans at a certain event, I don't see that the Board of Health or the state would trump that. You know what I mean? I think that's what that committee wants, and that's the ceremony, and that's that. So I think I'm being confused. I'm also thinking ahead to town meeting, for instance.
Mm-hmm.
We have put a lot of restraints in place.
Mm-hmm.
So I just want you to think about, and these are restraints that the Board of Health has been the lead on, not the lead period, but the Board of Health's direction to the town is one of the points of lead. So, I don't know, for instance, whether this will change how we approach town meeting on the 13th in terms of numbers of people.
So it would definitely allow town meeting to be moved indoors, as I read it, and at any density of people that you want.
Okay, then I will, I'll wait for your communication, Deb, and then if you can copy Carmen on that, that would be useful.
I mean,
What do you want from me? I guess.
I don't know who's communicating the conversation here tonight to Stephen.
So Stephen had asked me, I had emailed him the sort of the press release that came out yesterday, and copied him when I sent it to the Board of Health members. And he emailed me back and said, if the board's going to be discussing it, would they be willing to make a determination that they either think what's gonna happen on May 29th is safe or not, and if they don't think it's safe, what we should be doing instead.
All right, then I'll let Carmen know that this was the conversation, and if that's gonna impact town meeting, then that will be on her shoulders.
I mean, it seems to me if you want to move it indoors and you wanted to ask people to be masked during it, I think, I don't know, that's just my thought.
I mean, it's whatever, the select board wants, I guess, you know what I mean? It's their event, right? So,
It's actually the town moderator, well, yeah, it's the towns, but I will hand this off to those who are gonna make the decision.
okay.
Thanks.
Is there any other events, Memorial Day and town meeting that you can think of that is going to have?
Graduation,
Exactly. There's a whole lot of events coming up that are fairly long in the tooth in terms of planning.
Yeah,
I mean, that's the real issue. It's not, can we do it? Because it's going back to old behaviors, but it's, do we have the logistics and the timing to switch gears right now?
and I've been approached by Picnic in the Park, which had decided not to hold Picnic in the Park, but now I think they're thinking about whether they could rejuvenate that. So,
Right. So that's what I'm saying. There's a it impacts a whole lot of, and not badly, just it's a timing issue.
yeah. I mean, I think, going back to Memorial Day, what that committee wants to do, going back to the town moderator for town meeting, I think just some thought needs to be applied to it. I'm not inclined to put in mandates on those events. I don't know what other board members think, but we're dealing with news that's less than 24 hours old, so.
Right.
I'm just thinking ahead as to why he asked the question.
right.
Well, I mean, I think the answer to the question is that we don't have any reason to give any mandates that are inconsistent with what the governor's orders are on this. So,
Right.
so then it still leads it to each group, each event, what they
Right.
want to do, as long as it's within compliance with the governor's order.
Right, and going back to what Jill said, I mean, we do have a pretty good vaccination rate in the town, and we've got, clinics for school kids to get vaccinated, and we're opening a, multi-town center to get more people vaccinated. So, I think things will continue to improve.
But it's really not unlike what individual restaurants have to, what kind of decision they will make, whether they'll open, and how many will they accommodate inside, and so it's really, the decision is up to the, I guess, the entity sponsoring the event. And I guess it's sort of, we're right on this kind of cusp period where some of the plans are in place, but as we get further into the spring and early summer, then there will probably be a higher comfort level with, going back to what was pre-pandemic policies.
Right.
But,
Yeah.
but I also think there's going to be a ramp up of behavior as well. I mean, there's still going to be people who are hesitant to join in big events, and it's going to be a while before everybody's out and about and fully exposed to one another. So I think even if these events take place, I'm not that concerned that they'll be overridden with attendees. People are still going to be hesitant and unsure how to go about public lives again.
Yeah, I think that's a really good point.
I think it's less, my points were not less about whether or not people would suddenly, flood the streets, as much as what's the town's responsibility in terms of making access available, planning for as many people as want to come.
I would think town leadership and Stephen Crane, would have to discuss that. Just make sure they still want to do it outside or inside or whatever. They'll have to have some, quick meetings, given the deadlines coming up.
Thank you.
It's unfortunate that none of us expected this. I mean, the governor had said right along that this wasn't going to happen until August 1st. So when it really kind of took us all by surprise when it got announced yesterday.
Yeah.
That seems consistent with the whole behavior, doesn't it?
Yes, it does.
Yeah.
My head's been spinning for the better part of a year, so.
Yeah, definitely. Okay. So we may expect to need to weigh in on town meeting or Memorial Day in the coming weeks, Susan, I would think, right? Or
Well, I mean, Carmen last year asked me to weigh in extensively but we had state COVID safety guidance that I was referring to. And now none of that guidance is applicable, so I'm not sure what standard I would hold it to. I mean, it makes it really hard.
yeah. Yeah, I mean, I'm sure they have plans in place already. It's, is it more work to change all that and move it indoors or not? I don't know.
I mean, they have a very safe event planned outdoors with all kinds of distancing and,
Well, I guess I would just say, I think the Board of Health is saying they can do it however they want to do it. And so they don't have to do it that way. But frankly, for the purpose of getting as many people that are comfortable to attend to still attend, I'm not sure they want to change it. And I think that should be a factor they think about, right? I mean, there could be plenty of, I wouldn't be shocked if a third of the Concord residents wouldn't want to go if it was suddenly switched to indoors. And they're also the people who are, the older population is also the people that are most attending town meeting usually. And so, at least for this year, and again, this isn't a Board of Health thing, this is just my opinion of what the town should do as sort of a resident. It seems like it makes sense until everyone's comfortable doing things, quote unquote, back to normal, that what they've already planned as being safe, just keep it as is. But,
yeah, that seems reasonable. I mean, keep the Memorial Day event to just veterans and keep the town meeting the way it's planned. I don't see that that's, I don't know. I don't see that I would recommend changing anything. But
although people in their safely distanced spots don't need to wear masks at least, right?
yeah. Mm-hmm. Yep. I don't know. What else do we need to talk about with COVID, Susan?
So we're holding 2 vaccination clinics tomorrow for 12 to 18-year-olds. You may remember back in February or March, we were approached by Pelmed's Pharmacy that offered to hold vaccine clinics for us. Then they had state supplied vaccine to do congregate care, and they were thinking that they could continue to get vaccine, and then they couldn't, so that offer went away. But they now have federally supplied Pfizer vaccine, and so they offered to hold clinics for us. So we've got 2 clinics set up for tomorrow and Thursday, advertised through the schools for both Concord and Carlisle. We have 1,000 appointments. So far, only 486 of them are booked. And we have a student population aged 12 to 18 of about 2,000. So it seems to me like parents are finding the vaccine elsewhere. Lori Hunter was feeling like anybody 16 and over probably had already gotten the Pfizer vaccine, and I think she's correct, because most of the kids that are signed up for these clinics are like 12, 13, 14, 15. So tomorrow morning, because we haven't really filled Thursday, I'm going to open it up to any town resident. Because if we're holding the clinic, let's vaccinate people, and then we'll hold the second dose clinic in 3 weeks on June 9 and 10. So I sure would have liked to have been able to do more, but at least I know we've done what we can.
Right.
Yeah. And what about the regional clinic? Are we, is that opening as well? With
So
the-
funny you would mention that, Deb.
Oh, no, no.
So Stephen had asked me to email Jana Ferguson at DPH and let her know that we had this offer from a private pharmacy, and would that bother DPH at all if we took a private pharmacy up on that? And she responded very quickly and said, no, that's fine.
Okay.
Go ahead and do it. It wouldn't jeopardize approval of the regional site. And then I had asked her, like, do we have a timeline on the regional site being approved? And this was all on March 6th. And she said, no timeline. And then I asked her, what is the state's plan for vaccinating the childhood population, since they're closing the mass vaccination sites? And she said that plan was still under development. And then today we got an email that our site is approved and we could start it as early as next week. But so the health directors involved are going to meet on Monday. I think all of us feel like our adult vaccination rates in our towns are really high. Many of the other towns are going to take Pell Meds up on the offer to run clinics for them. I know that Lincoln is doing it. Bedford is doing it. I think Wayland is doing it. So, you know, if most of our kids are vaccinated and most of our adults are vaccinated, is it worth it to gear up this clinic and try to run it, you know? I mean, most of the mass vaccination sites at this point, you don't even need an appointment. You just walk in, the attendance. I mean, it seems like we've met most of the need in the state. There are many places where people can be vaccinated. So I think we have to think about whether it's worth gearing up to do it or not. You know, we have, part of the agreement is that we vaccinate anyone who wants to attend from any town. So if all of our residents or most of our residents are vaccinated, do we really want to put the effort into using town staff to vaccinate people from other towns?
That's a good point.
So I'm sure once the health directors talk, I'll talk with Stephen and we'll decide what we're going to do.
Okay. Do we have any elderly people, shut-ins that still need vaccination in the town that we know of?
So Tricia did 2 homebound clinics and 1 in Carlisle. And then the state has a mobile program that they will bring out to people. So I can sign people up if I become aware of them, either through the COA or people getting in touch with me. So I think we've got that covered.
Okay. Yeah. I just want to continue the vaccination effort. I'm just worried that and maybe Jill has a better sense from public health what she thinks will happen, but I'm just worried that with things opening up, people may feel like there's not that pressure to get vaccinated. And if it's harder to find a place, I don't know what you would think about that, Jill.
You know, there's a part of me that says if we have the ability to vaccinate somebody from outside of town, we should be vaccinating everybody we can, but using town resources when there's so few, I'm not saying we should. In theory, I would wish we could without considering that. I think there's going to be a lot of confusion about and much less pressure on people to not get vaccinated, those who haven't, because we can't distinguish them from anybody else, you know? So I don't know. I don't know. Okay.
I guess, you know, I have a 14-year-old son. And so I had done the like pre-registration on the state site right after, you know, the Pfizer vaccine got approved. And then got a text message saying, here's your, you know, your ID number, or whatever code number, you can register for a vaccine at whatever Natick and Gillette and all these places. And every time I went in, I couldn't, you know, it was like no vaccination appointments available. It was just, I kept getting this message, but then I logged on to CVS and got an appointment there. So, you know, I think it isn't super easy, but, you know.
But the resources are there.
Yeah.
Yeah.
And you know, I thought we'd fill 1,000 appointments really quickly and we just haven't filled them.
Well, I would have gotten it done in Concord, but instead of driving to Lowell, had
Right.
I known. Yeah.
Yeah, Susan, if you have the ability to open it up beyond the schools, how is that getting promoted? How's that
I'm
getting?
gonna send it out on news and notices tomorrow, and it is really short notice. We've had some trouble with the Pelmed's website registration, and I didn't want to send it out until I get the website fixed tomorrow. But then I will send it out and people will only have a day to register, but you know, it's gonna run from 4 to 8. So if you really want to get there, I'm guessing you can find a time to get there.
And are all our teachers vaccinated and stuff? Like, is there any, okay,
Yeah, Lori Hunter seems to think so, yeah.
okay, all right. Or I don't know, town employees, like who else could we vaccinate?
And Steven seems to think that most of the employees are vaccinated. I would happily have any of them too. I mean,
Yeah, okay,
but you know, he gave all the employees, you can take time off from work to go get vaccinated without even using sick time. So, you know, that's a very generous thing to do. And
yeah,
I think people have taken advantage of it.
yeah, that was smart. Yeah, good. All right, well, we'll try to fill those 1,000 spots then.
There's a way to announce it to, like, you know, there's the business partnership, you know, to get the word out to the restaurant staffs and some of the other workers in town. There's the Concord Business Partnership,
Yeah, that's a good idea.
because they're not, you know, in the school system, and those are people that perhaps can't get off of work if they have employees.
Yep, that's a good idea.
Reach out to the Colonial Inn and, you know, the Best Western.
Yep.
And then I can mention it at the chair's breakfast tomorrow. What's the link to sign up for the clinic tomorrow?
I don't have it, but have anybody email me and I'll send them the link and the instructions.
All right.
Marriott also.
Yep.
All right. Okay. Anything else COVID related?
I think that's everything.
Okay. Should we move on to agenda item 4? Board calendar and minutes. Do you think we'll continue to meet via Zoom?
Not sure yet,
Okay,
because the governor's state of emergency ends on June 15th, and that's our next meeting. So I'm thinking we'll probably be one of the last Zoomies.
okay, all right.
I think. Who knows?
So one more meeting of reading that paragraph. All right.
Maybe, yeah. And remember the January minutes, everyone else had read through and made comment, and we were waiting for you, Dr. Green, and you looked it over and felt that
Yeah,
that week was fine. So we need to approve the January 20th meeting minutes.
okay. Do we have to take a vote on that? Okay. Can I have a motion to approve the January 2021 meeting minutes?
I move to approve the January 2021 meeting minutes.
Thank you, Jill. Do I have a second?
I second it.
All right. Okay. We'll vote. Jill, since you moved the motion, I assume you're yes.
I'm approving, yes.
All right. Mark,
Approved.
Alma,
Approved.
Ray.
Oh, he's muted.
Oh, Ray.
Approved.
All
There
right.
you go.
Okay.
And I approve as well. Thanks for doing that, Karen.
You're welcome.
All right.
And then on the March 16th draft that I sent out last week, Mark had a few tweaks and Alma had one word change. So I don't know if everyone's had an opportunity to look at those. Those were pretty quick and succinct.
Yeah, I thought they were good.
Okay, so then we could approve the March 16th meeting minutes as well.
Okay, do I have a motion to approve the March 16th, 2021 Board of Health meeting minutes?
So moved.
Second?
Second,
All right, how do you vote? Jill,
Approved.
Mark,
approved.
Alma,
Approved.
Ray,
Approved.
and I approve as well. Thank you, Karen.
Thank you. All right.
Any issues with the calendar for meetings? Anyone, holidays, vacations?
July 20th, I won't be available.
I will be around, so do we have two others for a quorum?
We could always go back to that, Dr. Green. if we-
Okay, all right. Okay, agenda item 5, board member reports. I have nothing.
I have nothing.
What a quiet bunch on Zoom.
I guess I could, one thing I could share is that Open Table is going to continue our distributions every, the first and third Wednesdays at First Parish
Mhm.
for residents of Concord and Carlisle. I believe as of now, they're continuing through the end of the school year. We're likely to continue it beyond that in the summer, although it might move to Kerem Shalom on Elm Street. Still in the works, but for now it continues. And it's actually been interesting. Each week that it's been operating, there's been about an additional 2 or 3 households each week that have signed up to get food, that are people that are new to us, new to need, presumably. So we've been really happy at kind of uncovering some real deep, hidden need in town.
Yeah, oh boy. Difficult times.
Yeah, they continue. They
Yeah.
continue. But the town's been amazing in terms of supporting us, in terms of donations, but both food and other resources, and it's been really gratifying to be able to do this work over at First Parish and to see that we are, in fact, reaching new people each week.
That's-
We've also been rolling out medically tailored meals, Healthy Helpings it's called, and it's going out through some of the COAs and through the Massachusetts State Infrastructure, Food and Security Infrastructure Grant. We are scheduled to get new equipment installed, which will double our capacity of prepared meals. This is what we've been doing in lieu of having the community dinners that used to take place at First Parish and in Maynard.
Yeah.
So we're doing these prepared meals. Some of them are medically tailored. We're looking what's likely to be expanded at some point to other, right now it's mostly for people with hypertension. Hopefully we'll expand into other health conditions to meet through dietary help. But it's just been incredible to see the demand for these prepared meals for both individuals and families. So it's real, it's been also very satisfying to know that even if we can't do dinners, we're getting food out to people that they really can use and have appreciated. So,
Absolutely, yeah,
Nice.
we're doing all we can.
yeah.
Great.
Staff reports?
Just the only thing I would report on is as you know, we received the Regional Shared Services Grant, which is $300,000 a year for 3 years to create a regional shared services, hire people and create some sort of governance structure for maintaining it and a financial sustainability plan. So we plan to hire a full-time public health nurse, which I hope will be Tricia, 2 environmental inspectors and a public health communicator which I'm excited about. So if we have something like EEE or West Nile virus, could create public messaging that could be used by all the member towns very quickly, or whatever, vaping, whatever the issue is, that is upon us at any moment. So we're excited to get going with that.
That's great.
Great.
Good. Awesome. Anything else?
Nope, not for me.
Thanks for all your hard work.
I second that.
Yeah.
Thank you. You know, the end is in sight. I wasn't really sure we'd ever get here, but I think we are.
I think we are too. Yeah.
But did things feel calmer at the hospital, Deb?
Yeah, they do.
That's-
Yeah. Yes, I am optimistic. Yeah, so.
Can I ask a question about the mental health impacts seen at the hospital? I mean, I think it's wonderful that we're through the first hurdle, but I know that other hospitals throughout the Commonwealth, my cousin has a child in significant need, and finding a bed at Children's was, for mental health issues, was almost impossible.
That's how it is in the state.
Yeah, I mean, I think there's less than 150 adolescent psychiatric beds in the state. So, children spend many days boarding in the emergency department, waiting for a bed.
Right.
So it's, and that was somewhat true before the pandemic. I do think there's a lot more mental health issues in adolescents. I mean, that's all the sort of data is pointing to that. So I think that will be a lingering problem that we are, the state is not prepared to handle.
Right.
So, yeah, there's not enough counselors, there's not enough therapists, there's not enough psychologists, psychiatrists, there's not enough beds, there's not enough partial hospitalization programs. So, yeah, it's not good. Not to end a meeting on a sad note, but yeah, that is.
It is sad.
Reality of it.
It was before pandemic, that was like that.
Yeah.
I'm wondering what Concord could potentially do to support opportunities here.
I mean, I think the school does a really good job. I think they have, good people in the schools. I think they, have opportunities at the school for kids to de-stress and stuff, but it's probably just a factor that there aren't enough people out there. I'm not sure what necessarily the town could do. It's,
Yeah, I'm just brainstorming because I know this is a need, and
yeah.
somebody has to step up.
Yep. Well, it is a bigger problem than we will solve here for sure. Yeah. Anyway. But I'm sure we will be talking about that in the months to come. But who knows, maybe it'll get better and kids will be better once they're seeing other kids' faces and maybe back in classes. Who knows? Who knows? I'll be optimistic.
When we did the Healthy Concord project, and stress was this huge issue for youth and mental health issues, and a lot of it was school related and activity related, and perhaps one thing that might come out of this is how we've all stepped back a little bit, changed how we're going about our lives, and maybe kids will be doing a little bit less. Maybe we'll be asking less of our kids, and perhaps it'll reduce some of the stress that had been pervasive here.
Yeah.
Family dynamics are a huge portion of this.
Right. There's different things that have taken place, the school related stress or the things that were factors then, but some things I think will be positively impacted.
Yeah.
Well,
Thank you.
All right. Well, I will move to adjourn the meeting unless there are any objections. Hearing none.
Nope.
All right, my friends, meeting is adjourned. See you next.
Good night.
Thanks, everybody.
Bye.
Thank you. Good night.
Good night.
Bye.